Good morning. I'm Katie Marschilok. I'm an Oley consumer, and I did work for over 40 years as a registered nurse. I'm an Oley consumer because I have intestinal failure, and why I have it is for unknown reason, unknown cause at this time. But it appears that my stomach and my small intestine and my large intestine are all affected with a GI motility disorder. I have spent more than 6 months of my last 4 years exclusively using home enteral nutrition. I've also had times when I had to transition for a year or more on home parenteral nutrition. And at the moment, I'm making a very concerted, serious, difficult effort to incorporate some enteral nutrition into my overall nutrition plan. And it's a challenge, as I know many of you can probably appreciate. As I said, I spent my 40-year career as a registered nurse. The last 25 years of that, I was in the chronic disease world, in that I was working as a diabetes educator, helping patients and families live their best life possible with diabetes. I had a real passion for that kind of work because diabetes affected me in my life personally. My son at the age of 8 was diagnosed in 1991. And then my daughter was diagnosed 10 years later. And I was quite immersed in my career at that time. Some of the things that I saw, learned from my patients who I helped educate and take care of, really helped me as I began my own personal chronic disease journey. And that's very much part of what I want to share with you today. These pictures were taken between 2015 and 2016, and they were within 1 year of me becoming ill. And what they're about is my husband and I really had a bucket list that once we retired, these were places we wanted to go, there were people we wanted to see, and we were starting to kind of check things off on our bucket list. These places were, the one on the bottom was Denali in Alaska, and we went many places throughout that state, did lots of hiking, saw many beautiful things. The picture at the top is the Burj Khalifa in Dubai, United Arab Emirates, and that's the tallest building in the world. The vantage point from up there is quite amazing, as you can imagine. One of the philosophies that really I learned from patients I was taking care of during my career, and I appreciated that when I learned this from them, and I tried to incorporate it in my life as I became ill and struggling with a chronic illness, was that you always have to believe that the situation that you're in can get better and that you have some impact over what better can look like. And this is what I mean. Sometimes too, you have to settle for the better that you can get. When I started my journey into this, I felt that better would look like me being able to sit down and eat a Thanksgiving dinner with my family, being able to go to a nice restaurant with family and friends and enjoy myself. That was my belief in the beginning of this, of what better could be. I had to readjust and adapt what better could be. And in my world today, better is any day that I wake up and that I'm feeling well and that I have energy to play with my grandchildren, to do activities with my husband, to pack up and take a trip and go somewhere. That's better. And some of the things that mattered to me before don't really matter to me anymore. I can still enjoy a Thanksgiving dinner with my family by sitting and taking in the sights and the smells and the conversation. I don't have to partake in the food. So that was my adaptation of what better can look like. The other thing I learned from my patients was use your skills, use your resources. And believe me, all of us, no matter what our walks of life have been, have many of them. First of all, there are things you can control, there are things that you perhaps can't control. And the things you can, control them and control them well. And I use these pictures kind of as an example. I can't control that I need all of these supplies and equipment and all of this stuff, but I can control where I put it, how I organize it, that I organize it in a way that's easy for me to get at things that make sense. And that's the piece that I can control. So skills that I learned throughout my career, through watching my patients deal with medications and supplies in their world, in their homes, I applied that to my own situation. Create your new normal. This is one of my favorite phrases. One of my favorite patients I worked with was the family. It was a mom of a newly diagnosed young girl. And this mom was incredible. That family had many, many challenges. You would not have thought that they would be able to cope well with this new diagnosis. And they were amazing. They did an amazing job. And that mom's philosophy was, I had to change what my normal was and create a new normal. And she did it so well. It was just incredible. And I've told her story again and again and tried to help other people do the same. Be the best at it. The pieces of it that you can control, do a really good job of it. And that will help you really feel better about it. And then use all the available skills and resources you have. And I count very much among the resources my family and my friends. And pictured here are myself with my husband, and then myself with two of my best friends in the world. And these women have been friends of mine for 40 to 50 years. So, and they don't even live near me. One of them lives in Virginia. The other lives in Seattle area. But we've traveled together. We visited each other. And we talk on the phone frequently, email, brief messages. It doesn't even have to be the friend next door. It can be just somebody important to you who's in your corner. And first of all, you look to find inspiration. I found inspiration in these friends and my husband and my family who care about me. They gave me strength, and they wanted me to feel better. They wanted me to be better. They wanted me in their life no matter how my life was. So that helped me tremendously. The other people to use and to have help you are your healthcare providers. And I think it's really important to establish good relationships with them and to really have a team that can help you. And it's great if you have people who in your healthcare provider team who have different perspectives on your situation. That's okay. It's good to have conversation, have dialogue. And it's also good to include professionals of many disciplines. I'm really amazed at the knowledge and how much help I've gotten from not only my physicians, but also my dietitians, my nurses, people who've really stepped up and been of terrific help to me from other disciplines, many disciplines. And then the real people who've been inspirational to me are people who've walked this path before me. The first Oley Foundation event I went to, I met a man who had been on home parental nutrition for 35 years. And after the event was over and I left Chicago and went home, I was so upset with myself that I should have stood next to him and asked him to do a selfie with me. I just felt so good to meet someone who lived that same life and struggled that same struggle and looked healthy and normal and well and had a smile on his face. Look for people like that. And if you can't see them in person, and certainly the last 2 years, nobody's been able to see anybody in person, but you can find them online, find them through the Oley website, read about them, the old newsletters. It's just, these people are inspirational. And if they can do it, you can do it too. The other philosophy I kind of have lived by in these 4 years is to tackle a reach goal. When the day comes that it's hard to get out of bed and put on your nutrition and do what you've got to do, if you think of a goal that's a little bit daunting and reach for it, then it makes the everyday things seem so much easier. And back in the beginning, in the first 6 months, this was my reach goal. We wanted to go to see Yellowstone National Park. So here we are at Yellowstone, and not just see it, but hike it and really enjoy it. And we did. And that was my big reach. But when you achieve that, it's an amazing feeling, that reach goal. It makes other things so much easier, seems so much easier. Now, how do you do that? To achieve that reach goal, it can take a village. And here's why. It can take a village to go from this is where I was at many times over the last 4 years. And this was February 2019. And when I had to make a transition from enteral to parenteral only and be on total bowel rest for months and months. And that's where it started, in the hospital. That was my IV pole and in the bed next to me. I wasn't skilled enough to do a selfie that I could get myself with all that in there, but I kind of wanted a recording to see where I was at. But if you try to go from that to something like this, making it happen, that village of people can help you and make it happen. And then the everyday is so much easier. So in my world, this was the ultimate making it happen. February, as I showed you, I was hooked up to that IV for an extended period of time. And then I went home on parenteral nutrition. In the first couple of weeks, it seemed overwhelming quite a bit, I do admit. But I had a plan that I had to be somewhere in April. And in April, this is where I was. This is where we were. Long awaited, long planned for trip to Egypt with 6 other friends. And both my best friends in the first picture you saw were, oh my gosh, you can't go with us. We're afraid. We don't think you're well enough. We just can't imagine you being there with us. We want you with us, but you just can't do it. My doctor had a lot of trepidation. He had known several couples who went, and each one of them regaled him with stories of the GI upsets they had had and how they had been sick while they were there and all that. And he was very worried and nervous for me. And he said, I want to tell you, you just shouldn't go, but I can't go there. I can't do that. How can I help? And that was the attitude he took on. And I just took it on that I just got to give it a try. And so we did. And with the help of all those friends, my husband and the doctor setting up some things that, okay, he sent me with an arsenal of medications, and together we came up with the idea with, well, maybe I'm going to need some extra IV fluids. Well, on this particular day, it was 105 degrees. And yeah, I mean, people were walking around with bottles of water, and which I couldn't drink at all, and still dehydrating all over the place. I had the IV fluids pumping into me 24/7, and I did just fine. Of the 8 of us on the trip, I fared perhaps the best. So never dehydrated and never got sick. So it was quite amazing. And actually, my husband and I are the only ones who didn't. He stayed quite well too, because he was forewarned that, he had to stay well and make sure that he was there to help me out and that he didn't have any down days. And he was very, very careful. And he has celiac disease. So he didn't eat anything out in the community. He ate very carefully. So I think it was between the two of us, it was that we limited ourselves so much. Me completely, him limited himself very much, and didn't take any risks as far as the diet was concerned. Had a wonderful time and survived 105-degree heat with only having been on home parenteral nutrition for less than 1 month at that time. So that was the big, big reach. And let me tell you something, when I got back from that trip, the everyday seemed so much easier. It was just, that part of it was amazing, how much easier that sounded. And now, what is my life like today? What it's like is my everyday challenges have changed. What they were pre-pandemic are certainly different from what they are now. And certainly in these 2 years since the pandemic, the travel issues have been not on the front burner anymore at all. But being an active grandmother and enjoying life with my grandchildren has been. So here's an example of a little bit of a reach goal that doing the big deal things like the travel to Egypt, travel to Yellowstone, made a little thing like this seem easier. My grandchildren live just a couple doors away from me, and we have a very walkable neighborhood. And we do a lot of outside things, taking walks together, playing outside together. And I was finding I couldn't keep up with them. Once they got on their scooters and took off, wanted to take off, I didn't feel I could want to keep up with them. So this was day one of me learning to ride a scooter and trying to keep up with these children, age 6 and now age 6 and 3.5. So do the big deal things, and then the little things will get easier, will seem easier, will give you a good feeling of accomplishment. And now that the pandemic is in a different place, we're back on the trail of going places and doing things again. And our next trip planned is to go to Germany and Austria this summer. And this was a trip that was planned for 2020 and has been postponed until now, the summer of 2022. But at the end of the day, to me, it's all about family. And it's all about that I can be here and enjoy these beautiful kids, my grandchildren, and also my 3 children and daughter-in-law and my husband. To me, that's what it's all about. And any challenge I have getting through the day, any challenge I have of putting the nutrition in my body, it pales in comparison to the blessings I have of these people in my life. And I feel too that I have a purpose. I need to be here for this next generation, because this sweet little granddaughter sitting on my lap was just diagnosed with type 1 diabetes 3 months ago at the age of 5. So I feel good that I'm still here, able to help her grow up well, live a positive, great life with diabetes, just like her father is doing, just like her aunt is doing. And I want to be there to help them and help make that happen. And in my world, giving myself the nutrition I need every day, whether it be from an IV line or through an enteral tube, it doesn't matter. Whatever it is, and I can do it because I want to be there for them. So I hope you can find the thing in your life that you want to be there for, and the ways to make getting there, giving your body full nutrition, can be made easier for you. And just reach out. There is such a wealth of information out there. On my sick days, I went online and read everything that is there published online on the Oley website. And then I went to the NIH website and read some more technical kind of things. But each time I learned something. So that's what I do on any day that I'm sick. I read about my situation and try to find information that can help me. But find the strengths in yourself first, and then in your family, your friends, and then find your inspiration in Oley and Oley members and others who can help you. And I really appreciate how much Oley has done for me and others like me. And I hope that you can find the same kind of help, and that you can have the very best of health and happiness into the future. I would welcome any questions be directed at the Oley staff, and I'll be happy to call you or email you or answer, if you have any questions on how I did some of the things I talked about. I'd be happy to be a source of support. Thank you so much for having me.